ناس كتير بدأت تدخل اهي. الآن احنا لايف. الآن احنا لايف على اليوتيوب، والآن بنعمل تسجيل على الكمبيوتر، وانا بدل حضرتك كده بعمل لك يعني دكتور خالد. اوكي. I will make you يعني a host إن شاء الله. بس دكتور يعني since you are the host يعني you will be in charge of admitting the people يعني.
والله admit everybody, make it easy for me.
ما أنا I admit everyone.
جزاك الله خير.
Okay. Make a host. Okay. Now I make you. You want to change the host to private? I'm admitting everyone now. You can now go ahead, inshallah. It's you are the host now.
بسم الله والحمد لله والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا علما نافعا يا كريم. اللهم آمين. Give me 1 second here to get the file that I need, and inshallah, just a second here.
Do you see any people are trying to join?
You can be a co-host, Dr. Sayyid. Maybe you can help with that if you don't.
Can you make me a co-host, please?
Yes.
Because you're the host now.
Yes, sir. I am making it right away.
Okay, make me a co-host, please.
Yes, of course. Just a second. Okay. We know Zoom. Uh-oh. So a little technical here. And no, come on. Co-host. No, I don't want to leave the meeting. Arib, I'm experiencing some problem, doctor.
Okay. Make me the host.
Yes.
And I will try to make you a co-host from my end.
I am trying to do that. Exit minimize window. Okay, host, participant. I'm trying to find it. It's my first.
Just click on my name. You see more. Click on more, and you will see it. You will scroll down.
Okay. Make as a host. You're a host.
Okay. Now let me admit all these people.
Okay.
I did admit all of them.
Yeah, it's better to have it open. Since it's open, that's great. Assalamu alaikum, everybody who is with us and who is joining. Jazakumullah khair for taking the time. May Allah accept this from us and make us gain in knowledge and be able to help others, inshallah, and help ourselves and our families. Jazakumullah khair. So let's see. I've been disabled now. If you can.
I'm now the host now. So
yeah, I think you can do a co-host. Wallahu a'lam.
And I'm trying. I don't know why it doesn't allow me to do it.
Can you just enable the screen sharing? Just enable the screen sharing, Akhi.
Yes. I enabled it.
You did? Wonderful. No, it's still disabled. You have to still put me as a,
here.
This is your screen, I think.
Yeah. You can start from your end. You can put yours on the screen and it will show.
It's not doing it. It's not allowing me, unfortunately.
No.
So
هذه بدي بالزوم.
دخلك انت في الزوم.
دخلت بعت ميساج دخلت.
If you could please mute your
audience,
mics,
yes.
That would be helpful.
Okay.
Okay, this is your screen, Dr. Ramadan. Let's see
Yes.
what options do we have here.
No, this is I will stop the share. Let me stop the share.
I requested.
Yeah,
I requested from you.
I muted everybody. Now I think I'm going to make you a host and you can start, inshallah. That's
Inshallah.
it. And please, when you are a host, just click on the participants at the bottom, and whenever you see someone trying to join, admit them, inshallah. This is the only way that we can do it. Okay.
Yes, of course.
Yes.
Barakallahu feek.
You are now the host.
Bismillah. Okay. Okay, Bismillah, walhamdulillah, wassalatu wassalamu ala rasulillah. اللهم بارك لنا في عملنا هذا يا حي يا قيوم ويسر لنا أمورنا وأنت السميع العليم. Brothers and sisters in faith, Jazakumullah khair for attending this meeting. My name is Khalid Kibati in English, Khalid Qabbati باللغة العربية. Alhamdulillah, I visited your community before in Fresno, and those who are with us from different cities, ahlan wa sahlan, you are more than welcome to join us in this one here. So, this being said, I'm contacting you and I'm doing this lecture from Columbus, Ohio, where I live, and I'm assistant professor at Guidance College in Houston. So it's an online university. And in fact, it is through Guidance College that we are doing this, alhamdulillah, tawfiq min Allah subhanahu wa ta'ala, and the help, of course, of your leadership, mashallah, Dr. Ramadan, and all the brothers and sisters who are involved. So, drugs. I wish I can make it interactive like I do when I teach, but I think the number of people joining us tonight is big, and maybe we'll not be able to do that yet. I will give you a chance, inshallah, to ask questions and even to make a comment if you would like to. Drugs, we heard about them. It's sometimes a taboo subject, and sometimes we think that it happens to others only, others in the dark, somewhere in maybe a downtown or in that area, or someone who is doing, something illicit, something wrong. And unfortunately, it is not. In fact, the us and them, we have to remove this from our minds and think that us, it's all of us. It can happen to anybody because drugs are everywhere and anyone can be tempted, anyone can fall into it. And in fact, it can affect many, many people at all ages. Every age. Okay, what are drugs? What are drugs? Let's look at it. Drugs are chemicals that affect the body and the brain. It's very simple. Everybody can say, you know what? Oh yeah, we know that. It affects the body and the brain. Let's say you have a toothache, you're sick, you have a stomach ache, you take some acetaminophen like Tylenol or ibuprofen, you feel better, it removes that. Well, this is one kind of a drug that everybody knows, everybody uses every now and then, and some people, they use it more than others. So we are not talking about that. We're not talking about this particular medical type of drugs, because there are other medical drugs that unfortunately are being misused. So we are talking about something different, okay? Just waiting for, okay, the types of drugs. Alcohol is one of them. All types of alcoholic beverages, from regular wine to hard liquor, such as whiskey, vodka, and you name it. There are so many on the market, you will be shocked. And we've seen movies where they are serving this and they're serving that, and they give a name to everything. All of that falls into alcohol, alcoholic beverages, and they are intoxicants. And we will see that. We'll refer to a verse from the Quran, okay, that I have kept for the end, because I want the beginning of this lecture to be more of a scientific type, where we hit the target and we hit the importance of understanding these drugs. Now, we have also another type of drugs, which are some type of natural herbs that can be found in nature, such as marijuana. Marijuana is made from the hemp plant, which is cannabis. Let me set this in the right way. Yeah. And it's called cannabis sativa. And the main psychoactive, whenever we say psycho, it relates to the brain, which is mind-altering chemical in marijuana, is this long term, which is a chemical, the chemical name of it, the scientific name of it, okay? And they call it THC to make it easier, okay, for people to know. So marijuana is another kind. Let's see if we have other types of drugs, all right? The hallucinogens, okay? Drugs that cause profound distortions in a person's perception of reality, such as the ketamine, the LSD, mescaline, you name it. This list here is very, very little that I have given to you tonight, okay? And the term hallucinogens, that means they create hallucinations, okay? The sensations of seeing something, but it is not there. I know there are some of them who can take it to an extreme where a person can see, for example, giant spider, or they can see something falling on them and there is nothing, but they make the brain go crazy and they create all these kinds of sensations. And not too long ago, we started to see what we call opioids. And here's this major danger here, because these are pain relievers, something like Tylenol, like ibuprofen, okay, with an origin similar to that of heroin. Heroin, which is a hard type of drug, it is from the hallucinogens, okay? So opioids can cause euphoria, and euphoria, it's extreme happiness, okay? Where you see a person just as if he's floating in the air, okay? And are often used non-medically, leading to overdose and death when they take too many of them. Those kinds are, you have codeine, you have so many names. If any one of you did the surgery, okay, whatever kind of surgery, sometimes even when the removal of a tooth, you may get codeine or you may get some other type of painkillers that are extremely strong, and they will create a sensation of like you're sleeping, but you're not really sleeping, and there is no pain associated with it. Now, there is a big danger with this one. Why? Because they can be found in the top of your cabinet where you put all your pharmaceutical products, okay? And you may tend to forget about it, and the child comes and finds it, or maybe someone told him about it or told her about it. So we have to be very careful about this kind, all right? Let's see. Now, if at any time one of you would like to make an interjection or ask a question or make a comment, feel free to do that, because I don't want to kind of get you sleepy and just by lecturing. I like when there is a feedback from my audience and people asking questions or making some comments. So the type, how do we take these drugs, we human beings? You have the inhalation, okay? That means through the nose. Some people take these drugs. The vaping, although the vaping is through the mouth, but because it's a vapor, so it will be similar to the inhalation. You have it by injection, and the injection is the strongest and the most powerful. In fact, when some people have a major accident, let's say on the road, and they have some bad injuries, usually they are given what we call morphine, almost on the spot by the health workers in the ambulance to immediately remove the pain and give them a feeling of being just fine. You also have by ingestions, that means we eat, the person would eat these drugs. And with ingestion, it takes time for it to take effect, okay? So now, what is drug abuse? We always hear this term, drug abuse. Clinically, it is known as a substance use disorder. By disorder, we mean that the person is no longer normal, okay? It's the use of a substance that causes some type of disorder. The person is not normal. And it's also called drug abuse or addiction. And we hear this term a lot, addiction. And it is caused by the habitual taking of addictive substances like those that we talked about. And most of the time, whether it's with the youth or with the adults, it starts through a friendly gathering, or two friends are together and one started taking this substance because somebody else told him about and gave him some, and he loves so much, or she likes so much her friend, and they say, oh, you know what, I'm going to share with you. Okay, just try this. Most of the time, this is how it starts. Or upon something very, very traumatic that the person goes through, and they end up starting doing drugs. You know, the loss of a family member, the loss of a child, the loss of wealth, a major crisis in a person's life, going through a divorce, and so on and so forth. So that's how usually it starts. Now you have substance use disorder. It is a disease. And this is what we need to understand. It is an illness that's causing people to compulsively use drugs. That means on and on by compulsion. There is like the body asks for it. And when I say the body, it's mainly the brain. And no matter what the consequences, the person keeps on taking these drugs. Okay. And we will see, inshallah, more. Let's look at this. Now, I like this definition of what addiction is, which is substance use disorder, by Dr. I have it at the end of this. It's a beautiful lecture that he gave in 18 minutes, and I do include a link in here that you can watch it. And he said addiction is any behavior that gives a temporary relief and a temporary pleasure, but in the long term causes you harm and has negative consequences, and you cannot give it up despite these negative consequences. Now, other than these drugs, okay, these substances, can something else be an addiction? Yes. Yes. And you will be amazed. It can be almost anything that becomes an addiction. And we are seeing it, for example, with the use of the cell phones. It became an addiction for us adults as well as our kids to just pick up the phone almost every 5 minutes, less for some people, more for others, and just to check it. And in fact, the studies that are done now on the use of cellular phones, they are showing like the person has like a kick, like a pleasure to see that someone sent him or sent her something, okay? Of course, it doesn't have a consequence on the health overall, but it is a form of addiction. Dr. Nora said, I'm admitting some people, so I may lose my my focus, but inshallah we'll get to it. So other things can be an addiction as well. For example, a gender relationship, okay? Not the marital one as we have it under Islam or even Christianity, other faith, but the desire to go with 1, 2, 3, 4, 5 different people, okay, to achieve that type of physical pleasure, and it becomes an addiction. وَالْعِيَاذُ بِاللَّهِ. In fact, Dr. Arif Shuaib, who is a psychiatrist in Houston, had a long discussion with me on this, and he explained to me that he treats patients that have a problem with this gender type of addiction, okay? Not to name it, but this is just another type. In fact, some people may have the addiction of wanting to buy things. They just buy, okay? And one of them said, I had to even leave my patient who was about to give birth. She was in labor, to go purchase some old musical discs, those that we use, the old records about the old music from Mozart and So addiction can be almost anything. And let's see why this may happen. It has a direct impact on the health of a person when it comes to the drugs. It has a long-lasting and permanent consequences, and some effects may continue even after the person has stopped taking the substance. Okay. In fact, it can lead some people to have mental illnesses. Now, how does it happen here? They cause the drugs, their effect, they cause a large amount of dopamine, which is a hormone that Allah subhanahu wa ta'ala has blessed us with. It's a neurotransmitter that helps regulate our emotions, our motivation, the feeling of pleasure. And it floods the brain when a person takes these drugs. The dopamine goes in excess and it floods the brain and it gives that feeling of high, they are drugged. But subhanAllah, the dopamine, the release of the dopamine in the brain because of those drugs, if it continues and the person is addicted, it will stop playing the role about our natural emotions, to regulating our emotions, motive. It will only trigger when the drug is taken. It's as if we cause we cause a damage to its own functioning by taking these drugs, and may Allah forbid. Eventually, drugs, they can change how the brain works and interfere with the person's ability to make choices, leading intense cravings and compulsive drug use. Over time, the behavior can turn into a substance dependency. That means the person is dependent on that substance, or as we call it, drug addiction. So the fact, for example, they say DUI, driving under influence. The influence of what? It could be influence of a drug, a hard drug, or a soft one, if we may call them this way, like marijuana may be called a soft one. Some states, they have allowed for marijuana to be used under some specific quantity. Others have not done that yet. And it could be also under a hard drug, like LSD, like heroin, or it could be just alcoholic beverage. And that's the DUI, driving under influence. And it causes the brain to malfunction. So the vision is going to be affected, the hearing, the motor skills, our ability to control ourselves and control the car if we're driving. And so it has a big, wide range of effects on the human being. So The overall, the effects of drug abuse and dependence can be far-reaching, very far, and they can impact almost every organ in the human body. Almost every organ in the human body will be affected, wal'iyadu billah. Not only the liver, not only the heart, the lungs, you name it. Side effect of drugs addiction, here there are some of them that all this information, by the way, is available on the internet. The majority of the websites that I used are public websites, particularly from government institutions, and it should help all of us, inshallah, to understand better these drugs. So a weakened immune system, definitely, increasing the risk of illness and infection. They can cause heart conditions ranging from abnormal heart rate to heart attacks and collapsed veins and blood vessels infection from injected drugs. So those people who inject drugs in their veins can collapse, literally, instead of having the natural cylindric or whatever the shape that Allah has created, those vessels may collapse. The heart may not be able to cope with it because some of those drugs, they increase the heart palpitations or pulses, and it causes palpitations that may go beyond the normal and can even end up with death. People experience also nausea and abdominal pain, which can lead to the loss of appetite or an increase in appetite or weight loss. So it just, every individual will be basically responding in a different way to the effect. The major strain on the liver, wal'iyadu billah. The liver helps cleaning all the toxins from our blood, and it takes a big hit with these drugs, which puts the person at risk, significant risk, liver damage or liver failure completely. Some people experience seizure, stroke, mental confusion, and brain damage, and sometimes it's permanent, in addition to the lung disease. So problems of memory loss, attention, decision-making, which makes daily living more difficult. And unfortunately, these people continue to take these drugs because they are sick. And I really liked what the few doctors that I listened to their lectures on drugs, they said, we have to look at it as an illness, and these people, they need help, they need treatment, they need counseling, they need professional psychiatrists and psychologists to help them cope with their pain. Most people who do drugs and they are addicted, they have had a very difficult past or a very, very, very difficult childhood, okay? And the reason they do that is because there is a void within, affective void, emotional emptiness, and that they try to compensate by the taking of drugs, wal'iyadu billah. So we as alhamdulillah, Muslims, as mature individuals, alhamdulillah, we're healthy, we have to start looking at it from not only, not only
whenever we come, for 10 times we come in and out, still Islam alaikum.
Okay, so we have to look at those individuals with a very compassionate type of heart and mind and eyes, and eventually guide them towards starting some treatments for them. The global effect of drugs on the body, it can also cause breast development in men. That means men start developing a breast, which is not normal, of course, and increases in body temperature. Some people feel hot, and which can lead, of course, to other health problems. The most severe is death. And if you read the numbers, it's very scary of people who do drugs, who abuse drugs, and they end up being dead. It's very, very scary. here are some also facts about opioids, giving us some estimates for 2019. 745,000 people had used heroin in the past, and that's based on 2019. 10.1 million people aged 12, look at this, age 12 or older, who misused opioids. And it starts from home most of the time when it comes to opioids, as I explained earlier, that they can be just normal medical prescriptions. The vast majority of people misuse prescription pain relief, and an estimated of 1.6 million people aged 12 and up had an opioid use disorder, which is another type of illness. And we are seeing it in many cities of the United States. In fact, now there are lots of laws coming up and already implemented in terms of forbidding or not allowing the youth to purchase some of those, particularly when it comes to vaping, okay, the use of those e-cigarette, they call it the e-cigarette. It came a while ago in the market on the basis that those who smoke it, they have less nicotine. And nicotine is a drug also, by the way. Nicotine affects the central nervous system, and it causes the release of adrenaline in our body, and it gives a sensation of high as well. So these are all numbers that I thought would be useful for our meeting tonight. Okay. In alcohol, adolescents aged 12 to 17, they drank alcohol, 2.3 million of them, in fact, drank alcohol in the past, and 1.2 million of these adolescents binge drank in that period, and that's all in the 2019, and so many other numbers. So alcohol, hard drugs, soft drugs, medicated drugs, all of those, they fall into the drugs that can affect the mind, the brain, and the body, and all the organs of a person. Excessive alcohol use can increase a person's risk of stroke, liver cirrhosis, alcoholic hepatitis, cancer, and other serious health conditions. Now, I want you to look at this, and I find this to be fascinating, particularly that it relates to what Allah subhanahu wa ta'ala tells us, okay? Now, here is the human brain, and the drug addiction takes over and destroys a user's key brain regions. This is the frontal lobe, okay? And it is part of the brain that is responsible for planning, decision-making, and social behavior. The drug abuse affects the user's ability to think and make decisions and use self-control. It's all in here, okay? Allah subhanahu wa ta'ala mentions in the Quran, in Surah Iqra, about an-nasiyah, okay? An-nasiyah, which is the forelock, or the hair that it is in our forehead, and that means taking a person like this, that's what the angels will do. Nasiyatin kadhibatin khati'ah, that's what Allah mentions. This part of our brain, all the major reasoning, emotions, planning, all takes place. And this is where the drugs are going to affect the most. Then you have this one, the middle one. I thought I had a better picture of these. The emotional processing center, it's right here. It has a name, I'll show it to you. And its stress and anxiety are increased with withdrawal. What is withdrawal? Is when a person is taking drugs regularly and they stop it all at once. Okay, so our body, our brain reacts to that and causes stress, anxiety, sometimes even sweating and other types of reactions. And people who are under heavy medications, such as for mental illnesses, those who have depression, major depression, bipolar disorder, and you name it. They take specific types of medications, and if they are to cut it, they have to cut it slowly, gradually, so they don't experience the withdrawal. Addicted users, they will use the drugs just to get relief from the stress instead of looking for the actual high. So once a person is really addicted into it, they are taking those drugs just to get relief from the stress, okay, that they experience. Now, the third part of that we have here, the pleasure reward center, this with repeated use, the drugs will decrease the pleasure for anything that is different than the drug itself. And that's what I explained at the beginning about the dopamine. The dopamine allows us to be happy, we make decisions, we are ambitious, as I said, we have relationship with people, with friends, with family members, with the wife, with the husband. But at one point, once the person is under drug addiction, it no longer plays that role except for the drug that the person takes. So what you have seen, the frontal one was the prefrontal cortex, as they call it, and the extended amygdala and the basal amygdala. Now, Allah subhanahu wa ta'ala tells us in Surah An-Nisa, يَا أَيُّهَا الَّذِينَ آمَنُوا لَا تَقْرَبُوا الصَّلَاةَ وَأَنْتُمْ سُكَارَى حَتَّى تَعْلَمُوا مَا تَقُولُونَ. O you who have believed, do not approach prayer while you are intoxicated until you know what you are saying. Now, we know that the forbidding of alcoholic beverages came in stages. And this was the first one. In fact, there are some big names, companions of the Prophet ﷺ, who experienced that. And in one of the narrations, it was Ali ibn Abi Talib radiallahu anh, who had dinner with Abdurrahman ibn Auf, and he was invited, and there was some khamr, there was some wine, and he said, he served us wine, and then I was asked to lead the prayer. And when he recited Surah قُلْ يَا أَيُّهَا الَّذِينَ قُلْ يَا أَيُّهَا الْكَافِرُونَ لَا أَعْبُدُ مَا تَعْبُدُونَ, he made a mistake in that very surah that we all know. Okay, and you can read that in the tafsir. So the word intoxicated is very interesting here. Allah did not say, why, don't get close to the prayer when you take wine. No, sukara, that means intoxicated. We are unable to make sound decisions and to know what we are doing. That's basically what the meaning is in here. And then the prohibition of alcoholic beverages came after that. And subhanAllah, Umar ibn Khattab radiallahu anh was always making a dua, oh Allah, bring us a proof, an ayah that will cure us from wine and the effects of wine. And then the ayah came in this, إِنَّمَا يُرِيدُ الشَّيْطَانُ أَن يُقَعَ, and it's not Surah An-Nisa, I'm sorry, this verse is in a different surah, Surah Al-Ma'idah. إِنَّمَا يُرِيدُ الشَّيْطَانُ أن يوقع بينكم العداوة والبغضاء في الخمر والميسر. Okay, في الخمر and والميسر ويصدكم عن ذكر الله وعن الصلاة. And then came the end of the verse, فهل أنتم منتهون. Okay, so I think I made a mistake in I just kept from Surah An-Nisa. But let's focus on the Arabic text. Verily, yuridu shaitan. Shaitan wants to cause between you enmity and hatred. Okay, in what? By encouraging you to drink alcohol and do the maysir. Okay, وَيَصُدَّكُمْ عَنْ ذِكْرِ اللَّهِ, and to get you away from the remembrance of Allah subhanahu wa ta'ala and from the prayer. فَهَلْ أَنْتُمْ مُنْتَهُونَ. And this is very key. Are you going to end? Are you going to stop doing that? And this is when the Sahaba realized that it became prohibited, and then later the Prophet ﷺ informed everyone that al-khamr was prohibited. Now, there are a few things here in this PowerPoint presentation. Dr. Nora Volkow, she has beautiful, and she's an expert in drug abuse as well as Dr. Gabor Mate, that I urge all of us to watch. Now, let's talk about us, and this is the verse that I mentioned about the Nasiya.
Dr. Khalid, Assalamu alaikum.
Yes.
We are like just 2 minutes actually from Salat al-Isha.
Yes, and that's why I'm speeding.
Can we, inshallah, have another session next week to finish it, inshallah, and maybe add more to that one?
Yes, we can do that, inshallah.
Yeah.
I want everybody to know that I am not an expert in psychiatry or psychology or drug, but all of us have some type of experience, okay, through friends who are experts, through others. The thing is, what happened with me is my interest in the youth, particularly after once they are teenagers and they are about to go on their own in life. That is my main interest, and how to help them face these difficulties and eventually navigate around without being harmed. And this is why I have this focus also on understanding the effects of drugs, understanding the different types of illnesses, mental illnesses particularly, and understanding also in general how we should live a happy life and avoid harming ourselves and those whom we love. جزاكم الله خير.
إن شاء الله. يعني
سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. بسم الله الرحمن الرحيم. والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. جزاكم الله خير.
Inshallah. So inshallah we will meet again next week, inshallah, for inshallah same time, inshallah, 6:30 on Saturday, inshallah, with a follow-up session. And if you can add, inshallah, talking about these challenges that face the youth at this stage, that will be perfect, inshallah. Jazakumullah khairan, brothers and sisters. May Allah subhanahu wa ta'ala reward you with the best, and may Allah subhanahu wa ta'ala make all of us from those who listen to the words and follow the best of them. Inshallah, we'll see you again in another session, inshallah. And if you have any question from what you have heard today, or you have any comment, or you want to the doctor, inshallah, to elaborate on more issues, inshallah, write them down and get them ready for next week, inshallah. Jazakumullah khairan. Jazakumullah khairan, Dr. Khalid. May Allah make it heavy in the scale of your good deeds. وجزاكم الله خيرا. السلام عليكم.
Thank you everyone. جزاكم الله خير. السلام عليكم.